Good afternoon, everyone, and welcome to this session. For those of you who do not know me, my name is Miguel Clemente, and I'm the Helpdesk Support for the ERN TransplantChild. Thank you for joining this webinar on the use of the CPMS platform. During this session, we will discuss not only how to actually use the platform, but also the need to do so. I will explain the process of accessing the tool, the CPMS tool, and uploading a consultation panel. And finally, I will give you the floor in order to ask anything regarding the use of the CPMS. So first of all, why the CPMS? Why do we actually have to use the CPMS? Well, when the whole ERN thing began back in 2017, the European Commission gave two main objectives to the different ERNs that were being were created. The first of the objectives was to develop a registry. As you know, for the TransplantChild ERN, the registry is actually the Peter registry. And the second the second great objective of the ERNs is to share knowledge among centers. And in order to do so, this platform, the CPMS, was developed. So the CPMS is actually one of the indicators, one of the main indicators that the European Commission uses to monitor the activity of the ERN. So if someone asks the question, why should I upload a case to the CPMS? If I wanted to be practical, my answer would be because it is one of the requirements to do so. With this in mind, it was established as one of the core objectives of the ERN that every center member of the TransplantChild network uploaded 3 cases, or 2 in the case of affiliated partners, between the 1st of March of 2022 and the 28th of February in 2023. So we have little over a month to fulfill this objective. Furthermore, the CPMS is a platform which is designed for consultation, and it is designed in such a way that allows to share clinical data in a safe and legal manner. And finally, it is also meant to be used as a tool for education and training, because younger or more inexperienced doctors can learn from how people work in other centers or in other countries. So as you all probably know, the CPMS is a tool that the ERN professionals can use to consult diagnosis, check for other treatments, request and give advice, or show interesting cases to the rest of the network by the use of consultation panels, which is the main structure on which the CPMS is based. So first of all, how do I access the CPMS? Well, the easiest way to do so is through the TransplantChild website. So you just type in your browser transplantchild.eu, and in the right-hand side of the main menu, you can click the CPMS button. This will take you to this new screen, in which in the right-hand side you can log into the CPMS. Now, if this is the first time you want to enter the CPMS or you do not have an account, you will have to follow the different steps which are shown below in the different bullet points. So first of all, you will need an EU login account, which you can do so from the third bullet point shown in the in the website. So in order to create a EU login account, you will be asked to introduce a mail address and a password for the EU login account. And then you will be asked to select a second step verification. Bear in mind that every time you need to access the CPMS, you will have to perform the two-step verification. So it is very important you remember how you established this verification method. So there are 3 main verification methods. You can install the EU login app in your mobile phone and choose a PIN code for verification, or you can use the app in your device to scan for the QR code. But mostly the people choose to give their phone number and receive an SMS and use the SMS verification method. Now, this will not require you to install the app for in your mobile devices, but it has been reported, never occurred to me though, that there are some times where the SMS can take a good 15 minutes to reach your device. Again, it hasn't never occurred to me, but just beware it may happen. Personally, I recommend the mobile app PIN code for those of you who are more versed with these devices, and I find it the most comfortable one. Something you need to bear in mind, and this is very important, is that not every mobile phone or phone number works when performing the two-step verification. So if in the first in your first login you gave your phone number and then you try to log in using receiving the SMS in another phone number, the system will give you an error and tells you that such phone number is not registered in your account. So keep this in mind. Once you have once you do a correct login, you will be shown this redirecting screen. And if you click in the options gear, you will be taken to a website which allows you to check your account details. So if in your account details you click on My Account Details, and you can see in the right hand side, you can see your mobile phone numbers and your mobile devices. If your phone number or your device is not registered in this list, that method of verification will not work. So keep it in mind if you are going to use more than one phone number or device. You should also note that you can add or delete phone numbers or phone devices anytime from this account user details. So if we have already created our EU login account, the next step is to request authorization to use the CPMS in your ERN, in your respective ERNs. So you can do so from the next bullet point. And if you click in the hyperlink, you will be redirected to the following website. This four-step request access permission, and the first thing you need to do is to select the application. So if you click in application, you will open a tab where you have to search for the CPMS platform. The next step you have to do is to select the organization you belong to. So you will find a list of all the ERNs, and you will have to look for a TransplantChild ERN, which is one of the last ones. Click on the open button, and then you have to look for your institution. First of all, you will need to look for your country, and inside your country, you will need to look for your healthcare provider. Bear in mind that you can also ask permission for guest access if your center is not a member of the ERN yet. And I believe there are some people in the chat in the meeting that had a guest account when their healthcare provider was still not a full member of the ERN. Finally, you will need to follow to step 3, which is to select an access profile. And these are the different access profiles that are available, each of them with different privileges or well, the two main profiles we are giving are the healthcare provider and the researcher. I've noticed recently that many of you who request access to the CPMS request to do so as coordinator. Please do not ask for permission as coordinator. It doesn't matter if you do so, because we will not give it to you, but because coordinator is not at a healthcare provider level, but at ERN level. So you would have access to the panels of all the people of the TransplantChild, that you will be able to close or manage the panels of everyone in the ERN. And finally, in the fourth step, you will have to actually submit your application. This application will reach us. I will personally accept your request, and then we will have to wait for the DG Santé to actually introduce you into the system, which may take a little time, but never more than 24 hours. So in case you request access and one day later you are still not able to join to enter the CPMS, please contact us so we can directly contact the IT support from the DG Santé. So now we have created the EU login successfully and requested access to the CPMS, and we can actually enter the CPMS. this is the CPMS dashboard, in which all the notifications will appear. So here you can see the panel activity in the last 2 weeks, and below that you can see the panel invitations, which you have to accept in order to actually access the panel. Bear in mind that in the CPMS platform, you will not be able to see anything of any kind of information about a panel until you have accepted the invitation. Now, the first thing I would like to ask of you, once you have accessed the CPMS for the first time, is to go to the ERN section of your menu that you can find on the left-hand side, and open the tab of ERN preferences. And where you see that it says My Professional Role, please select, choose your professional role. This is very important, as I will explain in a moment, because it tells you how it lets everyone know what your preferences are and which kind of panels you should be invited to. So the first thing you need to do to create a panel is to enroll a patient. So from your healthcare provider tab in the CPMS, you click your healthcare provider, and then you click on enroll a patient. Keep in mind that before enrollment, that patient needs to have signed the informed consent form that you can find in our website, transplantchild.eu/helpdesk/consent. So this is the tab that will open up once you are trying to enroll a patient. Keep in mind that you will be able to download the informed consent form from here as well. And these are the tabs that ask for the consent, for the informed consent form. The CPMS does not actually require you to upload the consent form. The consent form, as you probably know, is something internal that each healthcare provider needs to keep and needs to store. But just remember that it is the responsibility of the people uploading the information to the panel to actually have the signed informed consent. Also note that at the right-hand side of the consent requested tab, there are some free text boxes. It is not actually required of you to give any kind of information, but it is a mandatory field. So you will need to be you will need to type something in order to be able to actually enroll the patient. But you can type anything. Just a full stop is okay. Once you have enrolled a patient, you will be directly led to panel creation. But in case you want to create a panel from an already existing patient, you will need to visit your healthcare provider site in the CPMS and click on patient list. Then you will need to choose a patient from the patient list, and at the right-hand side of your screen, as you can see, create a new panel. Now, in order to create a panel, you will need to fill in a lot of information, or maybe not. So actually, as you can see in the left-hand side, there are many sub areas that need to be filled. But actually, only the first of those fields, which is the consultation request, is mandatory. So in this one, you will need to give a nickname to the panel, and the consultation request description, which is the actual consultation or the question that you would like to ask in the panel. The point of care specialist refers to the doctor that was in charge of the panel, and the next area would be episode description, would be where you start filling in relevant information about the case. As I said before, you can notice that there are many fields that are that you can put your information in, but it is not mandatory that you fill every single one of them. You only need to fill whichever information you feel is relevant to the question. At the bottom right side of the screen, you can find the Save button. The moment you click Save for the first time, the panel is already published, but don't worry, you will be able to modify it anytime. In the different sections, you will also be able to upload any kind of medical documentation, such as medical imaging, reports of the case, and so on, in many formats supported, such as Word or PDF documents, image files, and so on. But in order to actually upload one of these documents, you will need to save the panel first. Just one very important remark is that everything you upload to the CPMS needs to be anonymous. So in the nickname of the panel, please do not write any kind of relevant information about the name of the patients. Do not write the initials of the patients. And if you upload any kind of medical document, please make sure that the name of the patient is properly censored. So, assuming we have successfully created a panel, the next step is to invite the experts to actually contribute to the panel. So in the next tab of panel members, you can click on available and invite the different experts that have a CPMS account of the ERN TransplantChild. As I said before, only those people invited to a panel will be able to see the information. If instead of going one by one through all the members of the ERN, you actually want to invite the ones that may have more relevance to the case, you can, instead of inviting people, you can invite an expert group. So there are different expert groups for the different specialties, which are cardiology, nephrology, hepatology, stem cell transplantation, surgeons, and pulmonologists. I think I'm not leaving anyone. And you can click on invite expert group to automatically invite all of those people. These experts will receive an email informing them that they have been invited to a panel, to participate in a panel, and they will be able to accept or refuse the invitation. So once you have been invited to a panel, you can go to the information of the panel and see this last tab, which says contributions and outcome. Here it is where the experts that have been invited to a panel leave the contribution and try to answer to the question that was originally posed in the in the consultation form. You will also be able to attach any file if you feel you need to, and there is also an option for requesting additional data in case the lead of the panel didn't include it in the consultation form initially. Finally, and this is for the people that uploads the panel, once you have received enough contribution, you will have to outcome and to actually write an outcome and sign off the panel. So based on the different contributions, you will write an outcome and click on save, and immediately the panel will become signed off. The moment the panel gets signed off, there will be you will become unable to further contribute to the panel or to change any of the information in the consultation form. So be aware when you do so that this decision you cannot go back on this decision. Remember to close the panel. It's not enough to sign off the panel, but you need to actually close the panel to end the consultation. So a quick CPMS summary. From a center perspective, you get the consent from a patient, enroll it in the platform, and open a new panel. Include the clinical information that you feel is relevant to answer the question you want to make the rest of the experts. Invite the members that you feel are relevant or will be able to answer your question. Gather enough evidence to make an assessment and develop an outcome and close the panel. From the ERN perspective, you will be invited to have a panel which you can accept or refuse if you feel you are not suited to participate in this panel, in this topic. You will be able to enter the panel, make your contribution, and contribute to the assessment of the panel. You will be able to request additional data if you feel you don't have enough to make a correct assessment of the situation. And you will also be able to schedule meetings in order to do live discussions of the panel. So this is my take-home message. Please activate your CPMS account if you have not done so yet. Upload panels regularly at a healthcare provider level, and remember to invite experts that are able to contribute to your panel. If you have been the one invited to a panel, please accept the invitations and leave your contributions. And finally, remember to close the panel. Is not just enough to leave them once you have received the expected outcome. And finally, feel free to contact us anytime if you have any question regarding the use of the CPMS. And that's all for the quick overview of the CPMS. Now I will open the floor to you, so you can ask any question or make any comment regarding the CPMS. Something I would like to add is that any trouble, any comment, something you would like to be that you feel that could be improved in the use of the CPMS, please tell us. We are holding regular meetings with the other help desk members of the rest of the ERNs, and discussing constantly how to improve the CPMS and promote its use. So any feedback we get from you is more than welcome.